Hello everyone, happy Tuesday. Hoping I'm catching some of you guys on your lunch breaks. If not, hopefully you can tune into this later. I am doing my first COVID update in a very, very, very long time. And it's an update that I've wanted to do for 3 years, right? But we've been in this thing so long by now. Hey, Angel. Um, and so it's taken me several days to wrap my brain around things, but on May 11th, the public health emergency and the national state emergency of COVID-19 ended. So does that mean that the pandemic is over? No, I'll get to that in a minute. But at least for the United States, the state of emergency has ended. And so that happened on May 11th. So I realize I'm like 5 days late, but I really needed a few days to process and to just go through some information. So I took notes on some of the information that's been compiled really through the American Academy of Pediatrics and the Children's Hospital Association, as well as the CDC. And so for the AAP and the CHA, which is the Children's Hospital Association, they have been, since the beginning of the pandemic, they have been compiling weekly, for 3 years, weekly reports of the number of pediatric cases in the United States. It's really an incredible feat to do this, right? Because this requires working with individual states. This requires going through mountains of data. And so they've done this every week, and they just sunsetted it last week with the end of the emergency, the COVID-19 emergency status. There were, throughout the pandemic, so 3 years, you guys, 3 years, 15.6 million children diagnosed with COVID. And that is 17.9% of total cases. The highest week of reported positive cases was, I think, ending January 20th, 2022. And that week had 1.1 million positive pediatric cases. Whew, it's a whole lot of kids. In the past 6 months, the weekly cases have plateaued at about 24,000 cases. But over the last month, it's dropped to 6,000 cases per week overall. And overall, that rate is 20,000 kids out of 100,000 kids. So those are by the numbers. Now, keep in mind, now as the pandemic has gone on and on and on, there's certainly less testing now. So, people aren't getting tested as much, I think, and there's less reporting, and that is objectively true. There's less reporting. So some of those numbers might be a little off, but that's the numbers that we have. Okay, so as far as the vaccine, let's just talk about the vaccine for a moment. So the federal emergency COVID status, right, has ended May 11th, and there has not yet been commercialization of the vaccine, and they don't expect that to happen by the fall. So, the government has purchased a certain amount of the vaccine, and that will be available. They're thinking into the fall. But then hopefully with commercialization, that bivalent vaccine will still be available, and that's 6 months and older that can get that, and hoping to have it as single dose vials. So, I have people ask me all the time, where are we with the vaccine? What am I doing? Do I do it? Do I not do it? And we can talk about that, and I can do a whole other live on the vaccine. Right now, where we are is, if your kids were vaccinated from the beginning, if they fit in the age range. Mine had Pfizer, had the initial, had the booster, and then the bivalent became available, and they had that one. And y'all, I'm totally lost in time. I don't even remember when that was. Like, their vaccine cards are somewhere, right? But I'll do a totally separate one about the vaccine questions. You know, do you get it moving forward? What do you do, etc.? Happy to help. So as far as treatment for COVID and kids, for those patients that are highest risk, Paxlovid is available. Now that's only for ages 12 and over, and you have to start it within 5 days of onset of symptoms. So like I've talked about Tamiflu before, that's a medication you should start within 48 hours of onset of influenza. For the Paxlovid, 5 days. So you do have a little bit more wiggle room there. But again, it is for the higher risk cases. IV remdesivir is also still available, again, for higher risk or very sick cases. And that is the only medication that can be given to the littles. So 28 days of age and older, and then 3 kilograms, which is a little over 6 pounds, and heavier can get the IV remdesivir. And the remdesivir is within 7 days of onset of symptoms. See, I think I'm keeping good time with my notes. Okay, so let's talk about Louisiana since we're here. So Louisiana reporting, I have to say the state did a fantastic job with tracking cases and reporting. Just really impressive work. So throughout the pandemic, for the over 3 years, the total number of pediatric cases in Louisiana, 290,581, and that's 18.2%. So in 2019, the total number of kids, and this is just a number dump, I'm sorry, it's just it's a lot of numbers. In 2019, in Louisiana, total number of kids, 1,087,630. So they're looking at those percentage positive cases, they're using that off of the 2019 population data, okay? So 18.2% of total Louisiana cases up until I think the first or second week of May were pediatric cases. And then when we talk about cases per 100,000 kids nationally, it was 20,000 per 100,000 kids. And in Louisiana, it was 26,716 per 100,000. So that case rate was a little bit higher than the national average. Moving on. I'm kind of proud of myself for like getting through this and not rambling. I digress. Let's just talk about MIS-C. So multi-system inflammatory syndrome in children, we've talked about a whole lot on this page. And so the latest changes in MIS-C and diagnostic criteria came in December of 2022. And some of those changes narrowed the diagnostic criteria a little bit, and some broadened it. So it used to be, initially it was fever, I think 48 hours or greater, and then it dropped to 24 hours, and now it's fever, any fever. So you could have 4 hours of fever, and that would count. Some of the end organ criteria has changed, and narrowing of some of the diagnostic criteria. But when looking at MIS-C, and so this is by the CDC's website from May 1st, 2023. So that's pretty recent, I think, of the total number of MIS-C cases since the beginning of the pandemic that we know of, right? 9,472 cases and 79 deaths secondary to MIS-C. The median age is 9, and they were, of those cases, the total number of cases, 60% male. And when you look at that report, it's the AAP has that report broken down state by state. Louisiana was of the 9,400 cases, Louisiana reported between 200 399. So in that range. Of course, Texas has much higher, has reported much higher number of cases, as did California, but population density, this is where we need Jack to give us all even more of a number dump, right? And so I alluded earlier to, is the pandemic over? So it certainly feels like it's over, right? But that is actually defined, or the organization to make the final call on that is the WHO, the World Health Organization. And that's because they're considering worldwide total cases. So not just in the US, but worldwide total cases. There's, the weekly positive cases is tremendously decreased from peak pandemic time, but it's still pretty high worldwide. And so the last number I can find on this was April 3rd, 2023. And that week, positive cases worldwide, 525,841. Now, the peak during the pandemic was 45 million in a week. But again, remember, we're not testing as much, we're not reporting as much. So taking that into consideration, that is it around 500,000 or is it a little bit higher? It's probably a little bit higher. And so that is COVID by the numbers. 3 years, it really is bananas. It feels like we blinked and we just move forward in time from 2020 to 2023. It's hard to believe that it's 3 years. I wanted to just end by saying, make sure you check in on your own mental health as it pertains to the pandemic, and talking to your kids, and definitely talk to your kids about this. The boys and I talk all the time about, like, this is unique, and like what you guys have gone through is unbelievable, and acknowledging that this was such a hard thing to go through. It was hard as adults. I mean, I can't imagine as a child having to go through this, and just acknowledging that for them and giving them the credit of, like, you did this, like, you were such a tough kid that you got through this 3 years. I tell the boys all the time, this is not something Jack and I have ever gone through, right? I mean, it's not something my parents have gone through. And so just taking time as families to process everything that's happened in the last 3 years, and how have things changed? But what do we take out of it that's maybe positive, right? We spend more time together as families, or, we have a dedicated game night. We try to slow down and not rush everything. And what's been the negative, and really talking through that and letting them know, like, hey, this is a really hard thing to deal with. And if you ever want to talk about it, like, let's just talk about it. But anyway, so I wanted to give you all of that, I think, overall, very cathartic update. Like I said, I wish I could have given it much sooner, but it is what it is, and that's it. I'm gonna do a few, like, live events, and I'll post them, and so people can join, and any questions that you have, any comments, anything, like, feel free to jump on and ask the questions. That's what I'm here for. And I'm not going to take pictures of my notes and post them because this is just chicken scratch. But I'll at least try to type up in a neat way COVID by the numbers over the pandemic and share with you guys. I think that's it. So thanks for joining. I'll still do some COVID updates here and there, but this channel didn't start, or this group didn't start with COVID. It started before COVID as a way to give health, wellness, injury, etc. information to parents to help them parent sick or injured kids, and that's what I'm here for. So thank you guys for following all during the pandemic, and talk to you soon.